Our hearts beat to a rhythm, a carefully orchestrated symphony of electrical impulses that ensure blood flows throughout our bodies. But what happens when this rhythm falters, when the music becomes discordant? This is the silent threat of arrhythmias, a condition that affects millions worldwide. Arrhythmias are more than just irregular heartbeats. They represent a disruption in the heart's electrical system, leading to a cascade of potential health problems. Understanding these conditions, their causes and treatment options is crucial, not just for healthcare professionals, but for everyone. This guide aims to demystify the world of arrhythmias and their treatments, particularly focusing on antiarrhythmic drugs. We'll delve into the different types of arrhythmias, their symptoms, and the various treatment modalities available. Join me as we explore the fascinating world of cardiac electrophysiology and the medications that help restore the heart's rhythm, ensuring the music of life continues to play. Imagine the heart as an intricate network of electrical pathways, carefully conducting impulses that dictate each beat. These impulses, generated by specialized cells, ensure the heart chambers contract and relax in harmony, pumping blood efficiently throughout the body. Arrhythmias occur when there's a glitch in this electrical system. This disruption can cause the heart to beat too fast, known as tachycardia, too slow, called bradycardia, or erratically, compromising its ability to pump blood effectively. Think of it like a conductor losing control of an orchestra. The instruments may still play, but the harmony is lost, leading to a cacophony of sound. Similarly, arrhythmias disrupt the heart's rhythm, affecting its ability to function optimally. Understanding the nature of these electrical disturbances is crucial for diagnosing and treating arrhythmias effectively. Arrhythmias can be silent and stealthy, often going unnoticed until they manifest as a serious cardiac event. However, many people experience telltale signs that warrant medical attention. Recognizing these symptoms is crucial for early diagnosis and intervention. Common symptoms of arrhythmias include palpitations, which feel like your heart is racing or pounding, dizziness, shortness of breath, fatigue, chest pain, and fainting. These symptoms can be fleeting or persistent, mild or severe, depending on the type and severity of the arrhythmia. It's important to note that these symptoms are not exclusive to arrhythmias and can be indicative of other health conditions. If you experience any of these symptoms, it's essential to seek medical advice for proper diagnosis and management. Remember, early detection is key to preventing potentially serious complications associated with arrhythmias. Arrhythmias are not a one-size-fits-all condition. They encompass a spectrum of irregularities in heart rhythm, each with unique characteristics and potential complications. Understanding these different types is crucial for tailoring treatment strategies. Atrial fibrillation, or AFib, one of the most common arrhythmias, involves rapid and irregular electrical signals in the atria, the heart's upper chambers. This can lead to blood clots, stroke, and heart failure. Ventricular fibrillation, or VFib, a life-threatening arrhythmia, occurs when the ventricles, the heart's lower chambers, quiver instead of pumping blood effectively. This can lead to cardiac arrest and requires immediate medical intervention. Other types of arrhythmias include atrial flutter, supraventricular tachycardia or SVT, and bradycardia. Each type presents unique challenges and requires specialized treatment approaches. Section 5. Beyond medication. Exploring treatment options for arrhythmias. Treating arrhythmias goes beyond just medication. A multi-pronged approach often yields the best outcomes. Lifestyle changes like exercise, diet, and stress management are crucial. These can help regulate heart rhythm and improve cardiovascular health. Medications control heart rate and rhythm. Surgical procedures like catheter ablation offer long-term solutions. Devices like pacemakers and ICDs manage arrhythmias. Section 6. Understanding antiarrhythmic drugs. Restoring the heart's rhythm. Antiarrhythmic drugs form a cornerstone of arrhythmia management. These medications act like electrical conductors in the heart, helping to restore and maintain a normal heart rhythm. They achieve this by targeting the intricate electrical pathways within the heart, modulating the flow of ions that govern each heartbeat. Imagine these drugs as fine-tuning the electrical signals within the heart, ensuring they fire in a coordinated and efficient manner. By doing so, they prevent the erratic impulses that characterize arrhythmias, restoring the heart's natural rhythm. These drugs are classified into different groups based on their specific mechanisms of action, each targeting different aspects of the heart's electrical system. This classification system helps healthcare providers select the most appropriate drug for each patient's unique needs. Understanding how these medications work is crucial for both healthcare professionals and patients, ensuring safe and effective arrhythmia management. The Vaughan-Williams classification. Developed in the 1970s, it categorizes antiarrhythmic drugs into 4 classes. Class 1, 2, 3, and IV based on their primary mechanism of action. Class EA1 drugs, sodium channel blockers, slow electrical impulses. Class 2, beta blockers, reduce heart rate. Class 3, potassium channel blockers, stabilize rhythm. Class 4, calcium channel blockers, slow atrial conduction. This system aids in selecting the right drug for arrhythmia. Section 8. Deciphering Class 1 antiarrhythmics, sodium channel blockers. Class 1 antiarrhythmics, the sodium channel blockers, are further subdivided into 3 subclasses, IA, IB, and IC, based on their specific effects on the heart's electrical activity. Each subclass exhibits unique characteristics that make them suitable for treating different types of arrhythmias. Class IA drugs, such as quinidine and procainamide, moderately slow down the conduction of electrical impulses in the heart. They are often used to treat both atrial and ventricular arrhythmias. Class IB drugs, including lidocaine and mexiletine, have a weaker effect on conduction velocity and are primarily used for ventricular arrhythmias, particularly in emergency situations. Class IC drugs, such as flecainide and propafenone, markedly slow down conduction and are typically reserved for treating serious ventricular arrhythmias or certain types of supraventricular tachycardia. The choice of a specific Class 1 drug depends on the type and severity of the arrhythmia, as well as the patient's overall health status. Understanding the nuances of each subclass is crucial for healthcare providers to make informed treatment decisions. Section 9. A deep dive into Class 4 verapamil and calcium channel blockade. Verapamil, a prominent member of the Class 4 antiarrhythmics, exemplifies the action of calcium channel blockers in restoring heart rhythm. This drug exerts its effects by selectively inhibiting the influx of calcium ions into the heart muscle cells, particularly in the atria and the AV node, the electrical gateway between the atria and ventricles. By limiting calcium entry, verapamil slows down the conduction of electrical impulses through the AV node, acting like a gatekeeper to regulate the heart's rhythm. This mechanism makes it particularly effective in treating supraventricular tachycardias, arrhythmias originating above the ventricles. Imagine verapamil as a traffic controller at a busy intersection, ensuring a smooth flow of cars by regulating their speed and timing. Similarly, it regulates the electrical signals in the heart, preventing rapid and chaotic contractions that characterize supraventricular tachycardias. Verapamil's ability to slow down heart rate and reduce the force of contractions also makes it useful in managing high blood pressure and angina, conditions often associated with arrhythmias. Section 10. Key takeaways. Navigating the world of antiarrhythmic drugs. Arrhythmias, a disruption in the heart's electrical symphony, represent a significant health concern affecting millions worldwide. Understanding these conditions, their symptoms, and treatment options is paramount for both healthcare professionals and patients. Antiarrhythmic drugs play a crucial role in restoring and maintaining the heart's rhythm, acting like electrical conductors to ensure a coordinated and efficient heartbeat. The Vaughan-Williams classification system provides a helpful framework for understanding the different classes of these drugs and their mechanisms of action. From sodium channel blockers that regulate the flow of electrical impulses to calcium channel blockers like verapamil that control calcium influx. Each class offers unique therapeutic benefits for managing specific types of arrhythmias. Remember, early detection and prompt treatment are key to preventing potentially serious complications associated with arrhythmias. If you experience any symptoms suggestive of an irregular heartbeat, seek immediate medical attention. By understanding the intricacies of antiarrhythmic drugs, we can help restore the heart's rhythm, ensuring the music of life continues to play.